Medical science classifies depression as a mental disorder. Usually such a diagnosis is made to patients who have two main signs: a lowered mood background, pessimistic perception of reality, minimal mental and motor activity, that is, pronounced inhibition. These symptoms are observed in humans for a long time, at least 1 or 2 weeks. Subscribe to our YouTube channel, like, write your comments, and do not forget to share this video. According to statistics, the number of people suffering from depressive disorders is just over 10% of the world's population. Most often it is diagnosed in women of mature age. In young people the disease is rare, but it is more severe and often ends in suicide. The disease is known since ancient times. It was described by Hippocrates, Socrates and Plato. At the dawn of the development of psychiatry in the 19th century, Sigmund Freud proposed his own interpretation of the origin of depression and its treatment with cocaine. There are a number of factors that trigger the mechanism of development of the disease. Psychotrauma. These are events that negatively affect the psyche: violence, illness, the loss of a significant loved one. Chronic stress associated with the high rhythm of modern life, increased social requirements, constant conflicts with people around. Hormonal changes in the body during puberty, pregnancy and childbirth, menopause and aging. Uncontrolled intake of certain drugs, psychostimulants, antidepressants, and their abrupt cancellation. Addiction, alcoholism. Severe somatic and infectious diseases, intrapersonal conflicts and exacerbation of accentuated personality traits, professional deformations and emotional burnout. There are obvious depressions and there are hidden depressions. Their symptoms may vary. Obvious depression is characterized by a certain pattern of behavior of sick people. They look sad, dejected, and self-absorbed. They are little interested in what is happening around, and even joyful events do not find a response in their soul. Patients with signs of obvious depression tend to retire, often cry, stop monitoring their appearance. In severe cases, they start using drugs or alcohol, quit work, stop communicating with the closest people. Latent depression is more difficult to recognize. Outwardly, such people remain well-groomed, regularly attend work, and can actively participate in public life. They control their mood well enough. However, the internal state of such people is far from comfortable. They are worried about fears and phobias, thoughts about their futility and senselessness of existence on Earth. External signs of latent depression are manifested by disturbances in sleep and concentration, episodes of deep thoughtfulness, and high fatigue. Psychosomatic manifestations are also possible: disturbances in the functioning of the stomach and intestines, pain in the heart, dizziness, and nausea. Detection of depression occurs through a survey and psychological testing of patients. Treatment depends on the severity and type of depressive disorder. Mild forms respond well to psychotherapy. More severe ones require the use of medications in combination with psychotherapeutic methods. Antidepressants are prescribed in extreme cases with the failure of treatment with other drugs or with depression with a pronounced suicidal component. Have you suffered from depression? What events in your life caused it, and how did it manifest?